In this webinar, we are going to discuss the importance of early feeds, breast milk and kangaroo mother care for infection prevention. Failure to give early enteral feeds require initiation of intravenous fluids and hence increases the risk of infections. Early and exclusively breastfeeds give survival advantage to neonates and prevents them against infections. Kangaroo mother care decreases mortality and morbidities among low birth weight neonates. Therefore, early enteral feeding, breast milk feeding and kangaroo mother care may play a very important role in preventing morbidity and mortality in neonates, especially in resource constrained setting. In this webinar, we are going to learn about the dangers of not initiating early enteral feeds. We will discuss common myths related to early enteral feeding, role of breast milk and kangaroo mother care for prevention of infections in low birth weight neonates. Failure to initiate early enteral feeds leads to establishment of intravenous line and provision of intravenous fluids. We know that any invasive procedure markedly increases the risk of acquired infection in neonates. These invasive interventions are likely to result in prolonged hospital stay. Because of these interventions, the mother and the baby are likely to be separated, which can affect breast milk output in the mother. Therefore, all these factors increase the exposure of baby to microorganisms, which increases the chance of healthcare associated infections. It has been clearly shown that breast milk, if initiated within the first hour of life, the risk of neonatal death is half as compared to neonates in whom the breast milk is started after first hour of life. Certain situations lead to unnecessarily delay of initiation of enteral feeds. These situations include, but not limited to, neonates requiring CPAP or oxygen support, maternal HIV, isolated episodes of regurgitation or occasional blood tinged aspirates in presence of otherwise normal abdomen, isolated episodes of apnea in otherwise healthy neonate. Thus, it is very crucial if the neonate has minor illnesses, but the abdominal examination is normal, we should continue feeds and should not unnecessarily delay feeds. It has been proven that breast milk has anti-infective properties. Breast milk is rich in bioactive factors which augment the infant's immune system and provide protection against infections. Such bioactive factors include immunoglobulins. These immunoglobulins are mainly secretory immunoglobulins whose primary function is to prevent bacteria from entering the cells. It is important to note that these immunoglobulins develop in mother and are directed against local pathogens. Therefore, they are likely to protect the baby against pathogens prevalent in the baby's environment. Breast milk also has white blood cells, lysozymes and lactoferrin, which have antibacterial, antiviral and antifungal properties. It also has oligosaccharides which prevent bacteria from attaching to the mucosal surfaces. Thus, breast milk is very crucial for infection prevention and all possible efforts should be put by the healthcare professionals to continue breastfeeds or expressed breast milk feeds. There are innumerable benefits of kangaroo mother care. Research has clearly shown that it prevents mortality by up to 40%, especially in low birth weight neonates. It also prevents incidence of nosocomial infections to the tune of 55%. Kangaroo mother care improves temperature of the baby and prevents incidence of hypothermia by 66%. These neonates are likely to be handled less, which further reduces their exposure to infection. Kangaroo mother care results in improved breastfeeding rates as well as duration of breastfeeding. Thus, it reduces the risk of infections. It also reduces the length of hospital stay and promotes early discharge, which means that the less exposure to pathogens. Thus, kangaroo mother care is an effective strategy in reducing incidence of infection. To summarize, in this webinar we have learned that the delay in initiation of feed increases the risk of death and acquired infections. Enteral feed should be initiated within first hour of life unless any contraindication exists. In presence of normal abdominal examination, Feed should not be withheld for minor problems. Numerous bioactive factors present in breast milk help in prevention of infections. Kangaroo mother care is an important strategy to prevent mortality and morbidity, especially in low birth weight neonates. Thank you.